for the nice words. With all my respect to my guru sitting here, Dr. Chako, Dr. Tejinder, and my new, very young leader, Mugambika, who is here, for whom I have come all the way from Manipal, and Dr. Diksha here. I think I know her last 26 years at Manipal, and we are very good friends and good neighbors. We are all here. I think I'm only nurse standing here in front of you. And I just asked whether all of you are from medical, and I said 100% medical. So, but I think we got to be a good human being first. Forget about what profession we have gone into. We have dissected our body into brain, specialized into brain, heart, and all that. But I think what is most important is how happy we are as a human being. And as Chako sir has rightly said, what are you giving to the community? At the end of the day, those of us who have grown little older will understand what is meant by growing older. And sir has rightly said today, if you go to the beautiful homes, the so-called mansion that you built, they are no other than just maybe a couple of older adults being there. So what is that one thing we can do as individuals? So before beginning into the session of working together, Mukambika has requested me to do something with the audience. And Dr. Asokan has rightly spoken on mental health. All of us being doctors here, first thing when people have problems, they come to you with a history of having bad feelings or bad emotions. What do you do first? First is prescribe medications, right? And all of us as people who come for help also, we are looking at one tablet that solves all the problem. But can we really solve it? I don't think so. Now we need to distinguish. When we have problem with our mind, we are treating our brain. Mind is like different. Are you getting me? We have problem with our mind, feeling low, feeling bad in the mind, but we are treating the brain. Give a lot of antipsychotic as well. So all of us in the health profession, we need to understand, is that permanent or temporary? Am I going to eat that medicine permanent or temporary? So we need to understand where we treat ourselves. That's the place where I went down to do my specialization in emotional freedom technique. We can heal ourselves, we can heal others. Very well we can heal others, and truly we can heal ourselves. So all of us are teachers. What is that one thing you have in common, all of us? When young students come to the campus, what do you feel like? Excited? Number of classes? Excited with the number of classes? Counseling? Getting teacher guardians? You get 10 students to mentor them for next 5 years. What is your happiness in it? Tell me one happy thing that you feel when new graduates come in, or you have the 4 batches along with the interns. How do you feel as teachers? Someone is smiling at me. Do you feel stressed out sometimes? Yes. Can we work on any one of them? Any one area you want to work on? We are many. Individually, stress are different. Stress of having? Is it too many class? Yeah, people who are married will have different problem. You have family also, class also, you have students also, patients also. So let's work on it. All of us, please leave your hand free. I know it was coffee time, but leave your hand free. Yeah, all of you, please put your hand together. We are taught by our parents how to pray. God is everything to us, isn't it? So let's use our hands, because why we have problem with us, either in thinking or body problem, is because we have not, we have block in our energy. If you are here today, it's because of energy you are here. If there was no energy, you wouldn't be here. So when there is a block in the energy, we are not there, right? So we have blockage. Let's work on it. So please follow me. Okay? Yeah, you can tap, you can tell the same thing, that you can repeat what I say also, okay? Even though I have lots of students and they trouble me at times, they don't listen to my classes, and I feel I'm stressed out sometimes, but I still deeply love and accept myself. Please repeat with me. I still deeply love and accept myself. Even though my family is hard for me to manage, family, college, students, patients, it weighs on me, but I still deeply love and accept myself. Please louder. I deeply accept and love myself. Even though the days are not so easy, it's hard sometimes. With my workload, ill feelings, sometimes not so good things happening to me in my life, but I still deeply love and accept myself. Please, little louder. Energy. I still deeply love and accept myself. I'm all set to take home all the messages given here. To be a good teacher, to be a vibrant teacher, to be a marvelous teacher, a mentor, who will my students, below me faculty, my peers, because I deeply love and accept myself. You are accepting yourself? Some feeling is there? Okay, I won't go beyond because of the time frame, but there is a way to work out. Maybe towards the end, I will also do some other techniques to tap on. So today I've been given the task of looking at interprofessional education, practice and collaboration. So how do you work together? All of us, we are so learned now. That is why we segregate. Super specialty. But when we come as a patient, whom do you look for? I want a good doctor. I want a good nurse. I want a good technician. End of the day. But we have split. 1 year, one specialty, another year, leg also above the knee one, below the knee one, left hand, right hand, we have super specialized. But as a human being, what we need is working together, learning together, working together, and collaborating together, because our life here on earth is very short. It's a short journey. But what have you kept for people to remember you? That one thing you want people to remember you. Whoever we are, whether great or small or big, doesn't matter. People will remember you for how you make them feel. And that is what is rightly said in the proverb. So how do we do that? All of us have worked. How harmonious is our working environment? You as doctors, you go to your clinics, you have so many people along with you. And maybe they are looking for what my consultant is coming for the round. But what did I give to them? What smile did I give to them? What emotions did I pour on them? Is it my anger, my happiness, my smile, my nice words? Choice is yours, whether it is negative or positive. Positive, you will have better interaction. Negative, you lose your friends. But how do we work together? So we have been doing this. Interprofessional education, practice, collaboration is not new thing. But we are trying to emerge and learn new, because we have forgotten to talk to people, we have forgotten to work, we have forgotten to acknowledge people. And that's the place we are looking forward to look at. Oh, my slides are okay. So we are forgetting to learn together. Now for me, right from beginning, maybe I narrate, as they are fixing the technological part of it, maybe I can narrate a little thing about how I came into nursing. Nursing was never in my list. But I wrote for my medical. Problem is, if you don't have money today's, those days entrance makes no sense, because you pour money, you get anything, and if you don't have money, you don't get anything. Because tragedy hit me when I was, 10th, and then I had to lose parents. So it was very hard for me. So I never thought that I would come to nursing. My mom asked me when I was going for nursing, "Are you sure you're going for nursing?" I said, I'm not sure, but I'm going, I said. Because seeing one needle, I can run away from home. I was so scared of one needle, and mommy asked, sure. This one question made me to think. So I said, if I have to do even nursing, I said, I will make you proud. And that's the stand I took. So nursing doesn't limit me anything, because nursing is one person. You can relate with so many people, and you can heal so many people. And that's where I landed up in Manipal 26 years back, and I have not gone back. People ask me, in my Aadhaar card is all in Canada, and in my airport in Manipur, they look at my face and they look at my Aadhaar card. It's something strange to them, and yeah, it's working now. Thank you. So my slide pattern has changed. Okay, fine. So for me is to orient you all what is IPE, IPP and IPC, that is practice and collaboration through education. So unless we learn how to sit in the classroom together, we are not going to have ease in the clinical area. So if you put these students together, I remember when I joined as undergraduate, biochemistry, anatomy, physiology was common class. So I know all my MBBS friends, I know all my allied friends. So when we go to clinical, we are like one friends and we go and gang and work together. But today, all of us put our classrooms separate, separate, separate. Then we expect them to work together. Where is it possible? Unless I have a boyfriend or girlfriend from there, otherwise it's not possible, right? And that is the working environment that we have created. So it is to build some effective skills. How do you work with people? Communication is something we learn right from the time we are conceived, we have learned communication, but in profession we have forgotten to talk to people. And that's the basic skills that we need to attain. And to identify some of those common barriers, I think you make the slide a little smaller because my content is going out of coverage. So I'll go ahead with that, no problem. So IP is nothing but when you learn to work with, from and about each other. So we need to work with people, you need to know about them because you need to respect their profession as well. It is not only my profession. Without, see you have all your 5 fingers, both the hand 10 fingers. We value some of them, but if you have pain in one, you really have problem because every finger has its own values. So understanding others' profession, understanding the roles and responsibilities, keeping in mind the ethics we need to abide by. I think that makes sense for us to learn together and practice together and collaborate together. So now if we look at IPE, so I have looked at certain literature. We don't have to even look at literature, it works. Because without working together, it's impossible for us to function. Improve patient outcome. So WHO already is saying that IP is key to building collaboration practice ready for healthcare workforce because this is the way forward. Manipal has taken up with the FAMER Fellowship on Interprofessional Education. Now the globe has 11 FAMER regional institutes, and of that 4 are in India, where Dr. Chako has started up in South in Coimbatore, Manipal, and CMC Ludhiana, and then GSMC Mumbai. So they are already 20 years old, and then Manipal is just 10-year-old in fellowship program. But we have taken up as a unique theme on interprofessional education because I think we need to start somewhere and work. We need to be working very, very harmoniously. So WHO has already said it very clear. So why IP? Because it enhances teamwork and communication. We learn communication. Medical college, EdCom is famous thing in that. We learn it, but most of the communications are taught in the classroom. How do we teach alone in the classroom? People need to interact. People need to interact. First of all, when you have your students, medical students are all from all over the country and even outsiders. People come and get shocked. So in fact, we have also developed some other module which can look into that. I'll come towards the end of the session, and that really works out. Communication is not just to be taught in the classroom, we must learn to make them interact. So what we have done is the voluntary service organization is teaching local language. So when the students join in the first few weeks, we give 15 hours of spoken language for the local language. Learning local language is very important. Here, how many of you understand Kannada? Okay, I'll translate, no problem. When I came first time to Manipal, people were very excited because I was the only one person with a small eyes, and yeah, with monkey cut, I had long hair, now I chopped it off, and the people look at me because I look very different. So my classmates were ready to experiment on me. First posting was community. So they said, when you go to community, see house and see women in their marriageable age, you ask, Akka Maduve Aita. Means, Akka, are you married? So if she says no, you ask, Istu Makalu. Means, if she says no, I'm not married, ask how many children. Okay. So I by-hearted whole night, Akka Maduve Aita, illa mean Istu Makalu. Okay. But for me, first time learning, when I went to community, I saw a woman, I ran, they pulled my chuni and said, Elsa, you get thapper on your face. And that's how my classmates experiment. But I learned those naughty things, and that's how I learned Kannada. And people don't hear what I'm saying. They are watching me how I'm saying. Because now also patients are very happy. I don't have to do anything much. If I say namaskara, if I say Telugu person, I say bhagnara. So if you know every language, at least 2-3 words, you make their day. Ask someone unknown. Nobody will expect that I know Telugu, right? So if I ask Bhagunara, they're so happy. So if you touch them with their language, can be a wonderful person to that patient. You may not speak everything. Not even now today, my Kannada doesn't have East, west, where is not there. Grammars are not a big thing, but people understand because you are not from there and you are trying to. And this makes a lot of sense for us to understand. So team communication and teamwork. So already there are a lot of researchers saying that the impact is it reduces medical errors. So when you communicate well, we are talking about patient safety, there is huge error which is not reported in India. US is reporting, and medication errors are the leading cause of death in the US, where they report everything. In India, where to report? We cover up. Any mistake, we cover up. And still our statistics is very high. So this is saying that we got to do safety work because we can communicate well and do a good teamwork. If you have done your good communication, we can reduce error. I'm not saying errors won't be there. Errors are there. That's why Institute of Medicine rightly said to err is human in 2000. And that's where patient safety is looked at all over the globe. So next is system efficiency. All of us are making medical college, allied college, nursing college, one corner. But accessibility, efficiency of how we work together is very important. We need to ideally think when we are making new medical colleges, new institutions, new organization, please look at wholesome to how we can be together. I'm not saying every subject you can learn together. At least some common subject where they can be taught, where they can mingle is something very unique that we need to think about when we are making it. To the old one, we have to cut and paste. It's very difficult, but when people are making new things, we need to understand this. So when system efficiency, because we all work in silos, we all work, we are like horse. We work like a horse, we see only this much. We don't see what's happening here, we don't see what's happening here. So we need to understand that identifying key departments where you can function together. I am not saying that all students from 10 colleges will come and sit, then it will become, you know, like convocation. It is not possible. But key topics, key departments where they can sit down together and learn together, that will have. For example, take pharmacology as a subject. Any pharmacologists here? Yeah, at least one I see pharmacology. You take the same, yeah, some pharmacologists are sitting out. What's his pharmacology? Find it's great. And so, like for example, you take pharmacology as a subject, just take one subject. Every health science student learn pharmacology. And we all learn very differently. And the same pharma teacher who teaches is not supervising in the clinical. What is taught in the classroom, somebody else is supervising in the clinical. So the clinical pharmacology is not touched anywhere. And who is explaining to every patient how the medicine works for them? We are talking about compliance, huge compliance we are talking about. That the doctor should explain who, now, who should explain? Either the doctor will explain, the pharmacy will explain, the nurse will explain. Who explains to the patient? Nobody. Prescribe, they give 2 minutes, we go. The doctor expects, the nurse will explain, the nurse expects, the doctor will explain, or somebody else. Who will do it? We have no idea. Who explained to them? And we talk about big compliance. Where is compliance? We never ever tell our patient how this medicine works for you. Medicine, that same medicine is given for multiple health problems. But how do you explain to them? And we talk about please comply. Where they'll comply? They'll put under, and we talk TB should come down. TB is rolling and rolling again in India because we have not actually touched the problem of their assessment on their non-compliance factors. So assess current relationship, schedule regular rounds, prepare thoughtful questions, act on the insights. So in the clinical, we say all are leaders. Every profession will say we are leaders. But situational leadership should come up here. In any situation, who is that one leader? There will be somebody who is leading the team and there will be members. For another situation, maybe another leader. We cannot find a permanent king in the clinical. We cannot find a completely a queen in the clinical, but there should be situational leadership that works out on patients, case-to-case basis. So this actually improve the system. So improve patient outcome, enhance staff satisfaction, increase operational efficiency, better resource utilization, and then we are talking about quality care. So when you enter the hospital, you are not entering as a teacher, you are not going as a consultant, you are not going to go as a nurse or as a doctor to find quality. You enter as a patient, then you will understand what is quality. Enter as a patient, then you will tell me what is the quality of that particular healthcare system. And that's where we need to define. So when we talk about IPE, some things are covered up. So professional identity, you may think when we say IPE, I will lose my identity as a doctor, I will lose my identity as a nurse. No one's identity will be lost. That is why you have white coat ceremony, nurses have lamp lighting ceremony, we take oath. All of us take oath, isn't it? We take oath. How many of us live with the oath? After that one is over, white coat is worn, everything is forgotten. Now we are taking out, even aprons are not in the clinical because of infections that is creeping into the clinical. Our students will not wash. When it becomes brown, they'll throw the police there. For that reason, now we are restricting people wearing apron in the ICUs, no way. But still, some people still wear, some people still wear and walk around, but because of infection control measures, we are having so, but with the oath, how many of us live this many years? That oath we took when we were first year, when we were in first semester. Did that oath remain till 5 years or 10 years, 20 years or 30 years? That commitment is what we are looking at. But we will never lose our identity. Okay, we will never lose our identity. Keeping our own personal, professional identity. When we are in group, we can also have group identity. That's why we call health profession. Now there's a huge team working towards health profession education, isn't it? And we have so many associations. Why are we having this? We are having this so that everybody comes in. Because health profession education membership is not only for people of only one kind. We are multiple people into that. That means we are trying to form an identity of serving people. But as serving people is not there nowadays, we are looking at personal benefits. What do I get from this particular association? So we need to understand there are also some factors that we are looking at. Some people feel that, the IPC, the predominant single professional education may result in a professional identity among healthcare students, which may support successful IPC. So sometimes some people have negative notion about it. They feel that identity will be lost. It will not be lost. It will enhance you as a good doctor, as a good nurse, as a good, say maybe a physio or whatever you want to name them. So personal proficiency is different. So when you go as a patient, all of you sometime or the other would have got admitted. I thought so many times. So when you want to look for a good nurse, you choose for your good doctor. You have, for that one problem you are, which doctor is good? All of us will do that. And that is your personal competency of being a good human being and being a good doctor. We don't go and fall for every doctor to treat you. We look for who is the best. Who is that person who will take care of you. And most of them will not be only physical expertise, clinical expertise, they look at you as a good whom you can talk to. Who listens to your problem. And that is what Dr. Asokan has spoken on, mental wellness. It's very important. And that's everything that can heal an individual. So meeting global healthcare challenges, we have too much problem. Indian population is huge. If you go to the market in the city only, we cannot take your car, crowded, right? Now Marilina is here with us. In the US you go, but there are problems in the US, and we have huge potential to grow also in India, because our population is huge when compared to any country except China. We have huge population. For this population, what are we going to do? But we are still very nice, I tell you. Today, you take an appointment, you can walk into your doctor's chamber. But in the US, you need 6 months to get your one appointment. But when they come that one appointment, they get everything, I tell you. When I was in Boston, I was looking at, they have only 5 patients that day. The 300 is their lifetime patients. For us, it's one day number. So they have only 5 patients, they have huge number of healthcare professionals. So these patients from station to station get everything done. That one appointment, because no more appointments in the next 6 months except in real emergency. But here at least in India, we get to see a doctor. Even outside the hospital also you can see, in their personal clinic, in their home, wherever you want, you can see your consultants. But that facility is not there. Though we criticize our population, still we are big human beings if you look at. But how can we improve that? How can we make our younger generation? Today, all of you sitting here, another 5 years, you are going to receive your alpha group generation as your first year MBBS student. Now these iPad babies, the alpha, how are you going to manage? By the time we'll grow a little more older, 5 more years older, some more of us will retire and go out also. The remaining teachers, how are we going to manage? The same group is coming to us, and we have all generation, all X, Y, Z, all generations are in your department as maybe professor, associate, assistant, lecturer, whatever you call it. And you're going to manage, you as a leader is going to manage all those. So understanding how to work together remains very important for us. So I have got one acronym, China map. So the climate change, you can look at, well, now today we are facing climate change issues with global warming. You see how many earthquakes? Can you stop the water? You cannot stop the earthquake, you cannot stop the water. If tsunami comes, we'll be all washed out, right? India took so many years to survive through the tsunami. Now so many things are happening in the world. The world is not at peace. And our healthcare is also trembling sometimes. So how do we make that possible? Okay, look at some of the global challenges. So when your students take up projects in groups, please let them sensitize them to some of these global health issues, which is affecting definitely our country in a huge, so they can work up together so that at least they'll realize. So I'm not defining everybody, but mental health remains very prominent, and today aging is a big problem. ICMR gives, this time ICMR grant had one area on elderly. We also applying because I very closely, I work for dementia, and elderly are very close to my heart. Imagine today none of us are going to be spared from death. We are going towards that only. We are not getting younger. We are getting older. Tomorrow, if we look at dignity, end of life, what is that dignity, how it is going to be defined? Nobody knows. Now children are all migrated, nobody is there. Then where are you going to look ahead? You have paid so much, you have struggled so much, because marriage is 25-year project. You look after your children, they become big people, they all fly out. You are alone. How are you managing about dignity at the end of life? We need to understand, we need to strategize. We can't sit idle. We have to think, what can I do? So that at least I die peacefully, I die with dignity. And that is what we are looking at. So aging population is a huge area of scope where you can make your students together, faculty work together towards achieving, because another 10 years we are going to have more elderly than youngsters. And the youngsters will all fly out all over, and then we have more elderly population. So what are we going to do for sustainability? We need to look at. So current time professional functioning. Many times we have distrust among ourselves. Huge. Distrust is very huge among ourselves. Ineffective communication, many a times, I remember one sentence between the nurse and the doctor. It isn't funny, but you can bear with me. How the nurse has communicated. Here the patient, patient is having not able to pass urine. So over the phone, the nurse says, "Doctor, this patient is not able to pass urine. You come and pass." Means she is asking him to come and at least prescribe something. But sometimes, English is of course not mother tongue, is father tongue. But when we miss, it means a whole lot of difference. In our day-to-day communication, sometimes we think that person has to understand what you are thinking here. But what we are saying is different than what we are thinking here. When we understand, because for Indians, we are low context people. If you look at communication, we are low context, means you should read between the lines. But if you go to America, everything has to be written down. They are high context people. They need to be written down with everything. For us, we need to read between the lines. But how can these young students read between the lines? How can the young faculty who is so vibrant and looking for marriage look at what you are thinking and saying? There could be a lot of mental blocks, and because of the communication pattern that's happening between you and the next person. So this is in one way miscommunication. Stress and burnout is very high today. Everyone is getting mad. That's why they sometimes break and give them a retreat, holidays, come back. Sometimes again you go 2 days, come back to the same workplace. But you cannot change people, we can only change ourselves. So if you are a happier person, you can be a better person in your institute or in your department. So conflicting roles and responsibilities among healthcare professionals, overwork, and sometimes, because in India we do not pay money for people who have overworked themselves for the organized. But in the West, for every hour extra, you get your pay. But here there is nothing like that. We work sometimes 18 hours also. But who looks at it? because you take up responsibility, that's why they'll tell you. But if you do not see this, if there is a supply and demand issues, there can be issues in the organization. Role confusion, disengagement, lack of collaboration. So if I'm only in that one unit, if I'm collaborating only with nursing and nursing and nursing, I don't think I can do experimental studies. So I was just going out and see if they can do, why not I? So when I was working on advanced wound care, because I do a lot of research in area of wound care, so you're coming out even with a mobile app, anybody, any caregiver in the house can take a pic and it comes to our servers and we can tell you this is stage 1, 2, 3, 4. So if it is 1, 2, what to do is already in the app. If it is 3 and 4, you may need a debridement, so they have to come back. So this is happening, and so we are already patenting it. And then I said, this is not the end. Now we need to go down and do experimental research. So we went down to do animal study. Now we are looking at OBGs. We get placentas, the umbilical cord. Okay, we are taking it and using for wound healing. The research innovation doesn't stop anywhere. When you find a problem, remember this is an opportunity. Every problem is an opportunity. That opportunity you must work on. But you cannot sleep and work. You have to dream and work. Sleep means you will sleep. Idea also will go, patent also will go, research also will go. But it is not alone. As a nurse alone, I can't do everything. So I have scientists, I have engineers, experts to look at many things. So I have other basic science scientists and also animal experts. So together only we can do something, because I have no idea some of the techniques. So I was learning from them, but learning from them is not complete because they are specialized in that area. So for me, is the person who gives the maximum effort should always be the first author. In many places I see that the guide is the first author because the student is scared and they put the guide first. I said, why? The student who is doing the work should be given the credit. The guide can be a corresponding author, but that too depends if you have done some work. If you have not done any work, why should I be? So we have to be authentic. The authenticity is coming in, looking at ethics. So look at core competencies. Core competencies is looking at, how you interprofessionally when you work and collaborate. We work on 4 basic competencies. One is values and ethics. Keeping in mind and ethics of every profession. Ethics while handling the patient, values and ethics while dealing with the interprofessional team members, and also clear roles and responsibilities. Suppose if there are 5 members in the group, what each one is going to do? Or you go to clinical, what is each one's roles and responsibilities? We do not have a clear demarcation. Somebody tries to be leader for everything, that doesn't work sometimes because it will cause unhappiness, because I also have my certain roles and responsibilities, my identity is there. So that has to be very clear cut, understood by all members. One is clear communication. If there is a clear communication between the members, I don't think any of the confusion will creep in. And next is teams and teamwork. Unless you understand each other, team cannot happen. Team spirit. So for me, till I came to nursing, I was always in the ground. I was a national player. So half of my time was always in the ground. So people didn't have to teach me teamwork, because when you play football, only one ball, right? Everybody is kicking on that one ball. Yes, but if you don't have team spirit, how did if I only one person take the ball here, there and try to score the goal, it won't work. It's a team. If you want to succeed and get the best, it is teamwork. But one must, as a team leader, you must acknowledge your team members. This is very important to raise their morale, otherwise they lose the interest and they'll say, let him only do, let her only do, and it will die, have a natural death. So keep up the team spirit, please acknowledge your team members, give credit for your team member. Then only your team members will function for a lifetime, not for only the project, but for a lifetime. So understanding these 4 important aspects are important in IP. Some challenges will always be there. Sometimes we are little stereotyped, okay? In hierarchies, I am the boss, so whatever I do only, whatever I say only you do. But we need to understand. So whether the leadership is, a hierarchical leadership or egalitarian leadership, means I take consensus of the team members. So you need to decide. Decision is yours. So whether you consider the consensus or consider yourself as only the leader and the boss, and that may not work all the time. So you must understand when you do project, you cannot be stereotyping. Institutional resistance, lack of faculty training, overload in the curricula. If you now look at the MBBS curriculum, when I was trying to, we do some programs in the foundation program, and when we look after the foundation program, if you try to do 1 hour work in MBBS, you will not get any slot. The timetable is jammed. Having the curriculum jam-packed, are we producing good doctors? Now you will all touch your heart and say, have I produced half-hearted doctors or have I produced good doctors? We need to understand, it's not about your number of hours of curricula, it's I finish my teaching classes, I am done. But have I made a good person? That we need to think over in our curricula. There is no place. So scheduling conflicts, these are conflicts. So when I want to conduct for them program, they say no timetable. Well, that foundation also is now jammed, completely jammed. Okay. So possibilities. So one is we have to have a mindset of buy-in from leadership and stakeholders, role modeling by champions. So when we say IP, it is now people in the beginning they ask, what is that IP? What is that IP? Please come for the workshops, come and enjoy. I tell them come and enjoy. Because when you conduct workshop for students, there are 2 things you have to see. One thing they'll ask, ma'am, is there food? I said, yes. Is it non-veg? Yes, then they'll come. Not because they want to come for your workshop, but the moment they come in, they enjoy the workshop, they start interacting, they are okay. Next time you call, they'll come. But those who have not experienced, they'll have that mindset, go or not to go. Second thing is, what will they get out of it? If you give certificate, you give credit, they'll come. But our mindset is stuck to that credit. But of course, that is good because students are growing, they need to fatten their CV. So that is what they are asking for it, because tomorrow they want a good job outside, not here. So we are almost preparing graduates for exporting, and that is how we are looking at when we're looking at for our country. So curriculum integration into the curriculum is one factor that we can achieve. Goal alignment, evaluation, evidence, I think is well spoken by many of the speakers. So challenges how to appreciate the quality of each members. One is lack of awareness could be another challenge. Negative bias that he is like this, she is like this, he'll be like this. Okay, these are the biases, but we need to understand the individual. Competitive culture, communication barriers, insecurity and fear, time constraints, lack of recognition, personality conflicts and leadership roles. If these challenges are taken care of, I think your department or your institution will be the place where people love to work. So it's way forward is our mindset. Only change our mindset, that's it. Sometimes we used to think how to handle these small ones. I said they are the most lovable people. Only problem is they have some problem with the issues of gadget. Because that gadget also, who has given the gadget? Parents have given the gadget. Okay? Many of us are parents and grandparents here. Some of you, how many of you are grandparents? I am grandparent to 7 kids, and I know how the younger children are very lovable. Only thing is they are gadget. But that gadget also very innovative. If they are used for good things, it will be good. They are used for bad things, is different thing. Our students are not less. They'll hide their mobile, shoes, under the socks. You tell them don't bring. They'll do anything anyhow. So sometimes in the class I tell them, keep your mobile on the top, use it. So I give them exercise on that so that they'll not see other things, they'll see my things there. So it is technique. As the previous have rightly said, innovative techniques, how do you use and how do you engage them? And that's very important for us. So mindset change. Change for learning together, change for collaborating. So we must introduce, always people think, let them come and talk to me, then we sit like this. But then I think I have to get up and say, hello, hi, I'm so and so, what are you doing? At least ask. And otherwise, how do I know who is who? But we sit and wait, let them only come, why should I go? This is our mindset. So we need to change our mindset, get up, have energy and talk with people and choose. I'm not saying that everyone you talk will become your friend, not necessary, because sometimes we have to see our wavelength also. When we collaborate, need to see similar mindset. Okay. So IP teaching learning can be already, I think the first speaker in the morning has dealt with all these areas of looking at. The one nice thing which I learned in the FAMER is IP escape rooms. That's right. IP escape rooms are very interesting. First time when they introduced online, because before starting the FAMER program, we have so many activities they have put. This escape room was something that was amazing. So online only you have to search. It's like a talent hunt. Something like talent hunt. It's an all group of students, mixed group of students. We are searching where it is. So we should know how to get out through the door. So like how you do talent hunt, they give you some instruction, they give you some tips, and they walk around. This actually makes them merge, gel, and then work together. So these are something new. Other than that, almost everything is already spoken in the morning. So evaluation of, you will think how to evaluate. If these students come together, which teacher is going to evaluate? Who is going to give them assessment? It's a concern. But it can be very well done. It need not be done for every procedure, but can pick up few things which we can do. As sir was talking about family program, that's the best place if you want to see communication. Peer communication. They are going out, right? Send them, all the healthcare professionals, medical student, nursing student, they all go for community posting. Send them together. You see the Vellore model, CMC Vellore model. The student, public health student, the nurse students, medical student, all go for community. 1 month maybe they are in the field. They work together, come back and present together. I think that model will work completely with these students. So let them assess how they communicate with the local people. The peer can assess. The teacher need not be even there. Because assessing 250 students is not easy task for the teacher. Unless you do a simulation, otherwise not possible. But how on real patient, how one interacts could be different. So faculty evaluation, self-assessment, self-reflection is well spoken by sir or the IP team observation in the real world clinical settings. Case reviews, debrief, and FGDs. This can work out in any new organization where you are just introducing IPE. I think these are the places you figure out what is best, which will work best, and you can start in small ways. So we talk about collaborative communication because we talk for a consensus goal that we are going towards patient safety. Everything it boils down to patient. Today, if students are not there, no salary. If patients are not there, where is our salary? There is no one. Our customers are very important to us. Maybe I'm talking from the technical point of view as customer, but if students, the medical college doesn't exist, if there are no patients, students, where will they practice? So these are things we need to look at. We have a common goal, and that goal is built on trust and integrity. If trust is there, nothing is there. Even in relationship, if trust is not there, nothing is there. So we must build that trust, which is very important. Integrity is doing, even if your boss is not watching, you are doing what you are supposed to do rightfully, and that's important for today it's actually healthcare. Medicine used to be very simple in the past, ineffective and relatively safe, but now it is very complex, effective and potentially very dangerous. So what decides drug and poison is only dosage. Only one pharmacology person is here. So what differences between a drug and a poison is only doses. So we need to understand and think that taking care of. So this is a small story where Emily Jerry was lost because extra amount of sodium was administered by the technician, and we lost the person. So there is a triangular effect in medicine, nursing, and pharmacy. If you look at very closely, just that one medication turn around, if the physician has given a wrong order, and if the pharmacy has dispensed it, and the nurse is giving it. So any mistake in one of these circuits will go wrong to the patient. Now who will be blamed? Let me suppose the patient has died. Now who is to be blamed? Whom to blame? Yes, so nurse here always is blamed, but then who goes to the court? The doctor goes to the court because you claim that patient is mine. Because this is warning. So one must understand the policy in the healthcare has to be clear. In Indian healthcare policy is not very clear. That is why today you will find doctors most of the time in the court for somebody's mistake. And this is for us to understand. So if you work together, so closed loop communication is what we talk. I'll just explain you with an example. So the surgeon shouts out, hang another unit of blood. Now who will hang? Who will hang? There are so many people standing around. The nurses are there, technicians are there, so many are there. Who will hang? Nobody knows, okay? Nobody knows who is going to hang it. But in a closed loop communication says, Mary, hang another unit of blood. And Mary hangs it and says, I have hanged another unit of blood. Alright? And this is where we look at simulation remains very important for undergraduates training program. because they don't know, every procedure is not going to be seen. Now undergraduate program is like go around and watch around. Only when they do internship, they are little serious, they start checking BP, they start checking temperature. Otherwise the whole year program, all subjects, they are wandering in wonderland. If you look at where teachers are going and seeing. One professor has 25 students around with them, it's like bagpiper going around. But have they really? You assessing it? How are you going to do it? These are common concerns that you will see in any institution. So using some of those closed loop communication techniques will work. SBAR technique works very well, and this should be emphasized in the organization. So when we look at this one patient, suppose somebody has diabetes. So the moment, see, diabetes, somebody will highly comply. Even if you highly comply, another 15 years, some complications will come in. Oh, all the pathies. Which are the pathies? From head? Neuropathy? Retinopathy? All the pathies you name under the earth. All the pathies will come in. So we need to identify pathies. Now how many people are required? You need all the doctors for all dealing all these one pathies, right? Then you need all the healthcare professionals. So are we working together or isolated? Today I will go to endocrinologist, next day I will go to the podiatrist. Then one patient will roam how long? One patient will roam how long to fix one problem? So if you are working together, if you have a clinic where you can see multiple people to see that patient one time, it solves the problem of the patient. Solve my problem, their problem also. But we don't work together. So the patient has to do touring. By the time he gets fed up, and he may go to Ayurvedic department. So we call medical shopping. And we scold them for medical shopping. And if the patient has gone to another department and come back, sometimes doctors don't see them also. They say, you already went there, you go there only. Our ego comes in between. Okay, so these are situations where a unique patient can suffer from. So working together always helps us together. So if we do not have in the curriculum IPE will not work. If it is not in the policy, it will not work. But in a small way, it has to be there. So it is a willingness of the administrators, willingness of the clinicians, willingness of the faculty to work with. Maybe start with a small thing, and you will see the wonders that's happening between the learners. And these are some of my success stories. First my fellowship I did medication safety. So I have here in the picture you can see my medical student, dental student, allied student, nursing student. My medical student, first time they are doing an IV cannulation, they are doing blood drawing. All these things are small skills. So when you cannot get your vein, you look for a pediatrician, you look for a nurse who is working there 20 years. And entry also want to learn. Very, very happy to learn these small skills. So these are how students learn. This is another advanced wound care. I also run the Interprofessional Advanced Care Wound Center 16 credit course, which is collaborated with Coloplus and European Wound Society. So they get 16 credit course. When they go out of the country, they can work as wound managers. So I have my medical students, my nursing students who come together to learn together. I even simulate. Some things are being simulated even on fruits. In the classroom, you can't get patient every single day. So how do you do debridement itself is a skill to be taught. You are simulating so that when they go in the real world, they'll at least understand how to do it and how to go. But remember, our skin is very tender, not like fruits. That also is there, but it can be simulated. This is another which I introduced in FAMER. Cultural humility. All of us boil down to trying to understand. We come from different background. Patients are coming from different background, and sometimes tomorrow we don't know what's behind it. So to understand culture, their beliefs, their norms, and being sensitive to the culture of that patient, and competency, able to do it right after assessing the patient is called cultural humility, completely. People talk about cultural sensitivity, but humility is above sensibility. So one must understand that if I know the patient's requirement, I'll be a very good doctor. I'll just give an example here. It's running out of time. When we work, these are medical doctors, and I also have my foreign graduates coming in between. So different countries, even India has huge differences. caste, creed. How many languages? Too much. Almost 2,000 plus. How many tongues? I don't know. How many caste, creed? We are so different. Even death ceremony is different. In the same religion, death ceremony is different for the caste, different caste. So it's huge difference. So if you want to be a good clinician, want to be a good person, I think understanding culture, humility will make you a very, very good person. And so challenge management is cultural barriers to be understood, institutional resistance, resource and infrastructure challenges that we can use it together, faculty resistance for readiness, policy and regulation, time constraints, and managing institutional faculty skepticism. What will happen if not? Also, what is there? What if works out well? So if you think it positively, everything will end probably. So as I feel, because all our faculty here, faculty development remains single competency, because if faculty are not prepared, how am I going to prepare my students? It's like you want to make dum biryani and you don't have chicken, don't have rice. Then how are you going to make dum chicken biryani? Not possible. So we need to be prepared. So development remains single important factor for the same. So we believe in working with, from, and about each other. With this, thank you so much. If any questions, I can answer.